Welcome to the Understanding Dementia Care video series, where we'll do a deep dive into understanding the components of a comprehensive dementia care model. I'm Elizabeth Gould, a senior research public health analyst and co-director of the National Alzheimer's and Dementia Resource Center at RTI International, with funding from the Administration for Community Living. Our guests today are David Bass, researcher and senior vice president at the Benjamin Rose Institute on Aging, and Katie Maslow, visiting scholar at the Gerontological Society of America. Thanks for joining us today.
Nice to be here.
So to start us off, why is access to comprehensive dementia care so important?
I think that access to comprehensive dementia care is important because despite all of the work that all of us and probably many people who are listening to this have done over many years, there are still many people living with dementia and many caregivers who don't get help that they need. And that can be for many reasons. It's very distressing when we hear it. The more we talk with people with dementia and family caregivers in various kinds of meetings and conferences and in person, the more we hear things that are not working for them. So I think that that's the basic reason that it's so important. So I'm going to talk a little bit about this sort of general issue and try to clarify a little bit what it is that we're talking about in terms of comprehensive dementia care. When you think about comprehensive dementia care, I think that what we're talking about is care that makes available all of the kinds of care and support that people with dementia and their families need. That also clearly involves a way of and a commitment to ongoing discussion with the person and the family about what they see as their needs, what they want. And so I think that a comprehensive dementia care plan would make available not only services, but also a way for people with dementia and their caregivers to choose to select the kinds of services that they want and need. Research, some of which David has done and many others have done, shows that various kinds of help that could be available to a person living with dementia or a family caregiver really work. They really change the person's situation. Not every person, but in a situation where the care isn't available, the person, the family member, will have worse outcomes. So this idea that that some programs have been shown to be helpful, shown to work, is very important within the concept of comprehensive dementia care. And we'll talk more about that later. When people receive the help they need, we often hear from them things like saying, I wish I'd known about this long ago. I wish that more people could have received this service that I received, or met and worked with, and then naming of the person that helped them, the program that actually helped them. So I think that those kinds of positive results and positive reactions from people living with dementia and family caregivers, when they get what they need, are the most important reason that comprehensive dementia care is important and meaningful. We have a lot of research on 6 comprehensive dementia care programs that are working in the United States in various communities. The data show that the people with dementia and family caregivers who are enrolled in those programs do well. They get what they need. But the programs, those programs which are referred to as comprehensive dementia care, not necessarily exactly what I was describing before, but comprehensive dementia care need more help in order to continue to provide the kind of assistance people with dementia and family caregivers need.
Yeah. How do you see your work influencing national policies and programs that support a comprehensive dementia care model? And that's for both of you. Katie, would you like to start?
Yes, I think that what we've learned, what David just described, and similar information from other comprehensive programs, I think that there, as I mentioned before, that there are 6 that are ordinarily mentioned in this context, but they differ in many ways from BRI care consultation, but they have that same focus on meeting needs and connecting people to what they need and trying to understand the needs of the person from that person's perspective. So I think that BRI care consultation and these other programs are the reason that the discussion is happening now at the national level about a payment model demonstration that would try to pay for the programs. They don't have a regular payment source, and thereby encourage similar or other programs like that provide comprehensive dementia care in other communities.
David, do you have anything to add?
I hope our work around this informs policy and other interested parties about how to bring together what now is a very fragmented system of supports between healthcare and community resources and community organizations. And I think to have a really good comprehensive model, you need both. You need quality medical care for people living with dementia, quality medical care and medical care providers who recognize and acknowledge the role of caregivers and pay attention to caregivers' needs, even though they may think of the person as their patient. So it's not just one person, it's certainly both, and it might be other family members as well. And you need healthcare providers to be aware of and help families think about using community resources that are out there.
Yeah.
Because many families really don't think of community resources as something that they would use. It's something somebody else might use, but they don't need that. They might think that the family can handle it. That's my job. I'm the caregiver. I don't need any help. Or they might think, as a caregiver, I don't need help. It's the person with the illness that needs the help. So why should I look to a community organization for supports, for example? And I think on the healthcare side, we need healthcare providers to be aware of what's out there on the community side and be encouraging families to consider it, at least let them know about it, and be talking not just to the person with the illness, but also the caregiver. On the community organization side, there needs to be a connection to the healthcare side. And that needs to go, the information that community organizations know about families is extensive. They often provide many types of assistance with daily living tasks, with legal issues, with financial issues, with all the kinds of things that dementia can impact other than the strictly medical side. And that information needs to go to the medical side so that physicians and other providers can understand what's going on with those families in a more comprehensive way. So that integration of various sectors of health, regardless of whether it's medical or non-medical, I hope that our work informs policy and procedures and comprehensive dementia care models that bring those sectors together more.
I was just going to say that I think that if we had here the 5 program developers for the other 5 programs that are being, they would be nodding and agreeing with David, and many of them, and I think it's true that all of them use someone that they may not call a care consultant, but that person's doing what the care consultant in BRI care consultation says. So even in programs, comprehensive dementia care programs that are based in a health system, there's a care consultant that's going out, working with the people, helping them find services. So I think that David put beautifully where we need to get now, but I think that having 6 of these, all of which show positive outcomes for the person with dementia and the family in randomized trials, has an effect. It bolsters the advocacy for payment for these programs.
Such great points from both of you. I really want to thank you for your time today to talk about this important topic. And it's been, a pleasure to hear your perspectives and your expertise in this field. For more information on RTI's expertise in this area, please visit us at rti.org and search for the focus area, Alzheimer's disease and related dementias. Until then, thank you both.
Thank you.